Welcome back, all of you, to the mock test explanation series for Government Nursing Officer exams. Let us go to the questions. The first question: the pH of human blood is between option A 6.5 to 7, option B 7.35 to 7.45, option C 8 to 9, and option D is 4.5 to 5. Let us see the right answer. The right answer is 7.35 to 7.45. A normal pH level for blood is between 7.35 and 7.45. We can see the pH chart here. 7 is in the neutral position now here. All the value below 7 is acid, and all the value above is alkaline. So below 7 acid, above 7 alkaline. Here in the second diagram, pH of blood is explained. Here the greenish zone 7.35 to 7.45 is the ideal pH level for blood. So blood is slightly alkaline, we can say. Next question. The normal range of respiration is option A 10 to 12 breath per minute, option B 12 to 20 breath per minute, option C 20 to 22 breath per minute, and option D is 16 to 24 breaths per minute. Let us see the right answer. The right answer here is 12 to 20 breath per minute. Let us see the chart of normal respiration for adult and different age of children. If it is less than 1 year, it is 30 to 40, and 1 to 2 year, 25 to 35, 2 to 5, 25 to 30 breath per minute, and 5 to 12 year, 20 to 25. Then if it is an adult more than 12 year of age, normal respiration will settle in 12 to 20 range. And here you can see this answer 10 to 12 breath per minute can be a confusing one, because this is the rescue breath rate or the ventilation rate per minute for an intubated patient in cardiac arrest. 10 to 12 breath per minute, or 1 breath in 5 to 6 seconds. So don't be confused with this option. The option A, the normal range is 12 to 20, and 10 to 12 is the artificial respiration or ventilation per minute ratio for intubated patient in resuscitation. Next question. During physical assessment of children, asymmetry of the skull indicates option A hydrocephalus, option B craniotabs, option C craniosynostosis, and option D osteogenesis imperfecta. Let us see the right answer. The right answer here is option C craniosynostosis. Craniosynostosis is a birth defect in which the bones in a baby's skull join too early, causing asymmetry of the skull. So bones are joining early stage, so asymmetry of the skull is happening. That is craniosynostosis. Hydrocephalus, this is the term itself, water on the brain, condition where too much CSF build in the brain. Craniotabs is a softening or thinning of the skull in infants and children. Osteogenesis imperfecta is a genetic disorder that causes bones to break easily. It's also known as brittle bone disease. So the memory tips comes: craniosynostosis, asymmetry of the skull; hydrocephalus, water on the brain, CSF increased production; craniotabs, softening or thinning of the skull; and osteogenesis imperfecta, brittle bone disease. Please remember these all topics, and if you need additional time for any question or any kind of topic, you have to pause the stream. Because of the time constraint, I have to go in a pace. Minimum speed I have to follow. So please cooperate. Next question. The substance that cause tissue necrosis and damage, particularly when extravasated are. Option A, apoptosis. Option B, interleukins. Option C, vesicants. Option D, retinoids. Let us go to the right answer straight away. The right answer is option C, vesicants. Vesicants are also known as blister agents, are chemical compounds that causes blistering of the skin and mucous membrane. Apoptosis is a type of cell death. So apoptosis is cell death. These vesicants are blister agents. Interleukins are cytokines that help the body to fight against infection, injury and inflammation. Interleukin released during COVID and all you have seen. So interleukins are the cytokines that helps the body during fight of infection, injury or inflammation. Retinoids. Retinoids are a group of vitamin A based product that can be used to treat skin conditions like acne, wrinkles and uneven skin tone. So vesicants are the right answer here. Next question. A training enema is ordered for a 55-year-old client before intestinal surgery. The maximum amount given is option A 150 to 200 ml, option B 200 to 400 ml, option C 400 to 750 ml and option D 750 to 1000 ml. Let us see the right answer. The right answer is 750 to 1000 ml. The amount of enema varies from 500 to 1000 ml. So, in this option, the closest range is given here 750 to 1000. So, this is the most appropriate answer here. Let us go to the next question. The type of pelvis in which the features are heart-shaped brim, narrow pelvis and sciatic notch with prominent ischial spines and suprapubic angle mouth 90 degree is option A gynecoid pelvis, option B antroid pelvis, option C anthropoid pelvis and option D platypelloid pelvis. You have to see the keyword here, heart shaped. So according to shape we are trying to identify, because don't need to waste too much time on this kind of questions. You have to identify the particular feature and hit on the target. Let us see the right answer straight away. The right answer is anthroid pelvis. Here the refresher memory chart for you. Types of pelvis. Gynecoid round shape. Gynecoid round. Here you can see the short code Grah Ops. GRAHAOPF. Grah Ops. So GR gynecoid is round shape, that is 50%. Anthroid is heart shape. See, this is H. Anthroid is heart shape. Anthropoid is oval shape, that is AO. And platypelloid is flat or kidney shaped. So here the question is heart shaped, so it is anthroid pelvis. Next question. The mode of transmission of trachoma from one person to another person is option A direct contact, option B indirect contact, option C both direct and indirect, option D iatrogenic. The right option is both direct and indirect. Trachoma is a ophthalmic infection transmitted through both direct and indirect mode of transmission. Next question. It was observed by a nurse that the medication prescription given by the doctor was wrongly noted by the nurse of the previous shift. Who among the following will fill out the report on this incident? This is an application level question, so read the options carefully. Option A, the concerned nurse who spotted the error. Option B, the nurse who committed the mistake in the previous shift. Option C, the supervising nurse who is in charge of the nursing. And option D, the original nurse who has assigned to the patient on the first day. Let us see the right answer here. The right answer is the concerned nurse who has spotted the error. Here, this is an application level question. It is depending on the common sense, logic, protocols, guidelines, etc. ABC protocols also will come. Here, there is no emergency or life-threatening condition. So, This is just purely application of logic. So who will report the incident? The incident reporting will be generally done by the person who is observing or who is directly attending the incident. So the concerned nurse is observed the error and she spotted the error and she have to write the report. The nurse who committed the mistake is not on the reporting part. She is the person who have to do the rectification and maybe sometimes she need to face the disciplinary actions if it is needed. Then the supervisor's nurse who is in charge of the nursing also not directly dealing with the reporting. She will be further proceeding with the report which is already written by the nurse who spotted the error and she need to take more actions on the report. She is not the one directly writing the report. The original nurse who was assigned in the patient on the first day is not significant here. So the right answer is the concerned nurse who spotted the error. So you have to know and understand the reporting system, incident reporting system, all this kind of standard protocols to answer this kind of application level questions. Next question. A general term denoting inflammation of the heart is option A, angina pectoris, option B, coronary thrombosis, option C, carditis, and option D, bradycardia. Let us see the right answer. The right answer is carditis. Carditis is the inflammation of heart muscles or tissues. Angina pectoris is also known as angina. It is chest pain. When the heart muscle does not get enough oxygenated blood, this angina will happen. Coronary thrombosis is the blood clot that forms in the coronary arteries of the heart. And bradycardia, as you know, it is the heart rate abnormally slow, less than 60 beats per minute. Next question. The activities of a person engaged in believing himself ill in the characteristics of health behavior, option B, illness behavior, option C, sick role behavior, and option D, wellness behavior. The right answer here is option C, sick role behavior. Let us see the sick role behavior. It is refers to the social behavior of a person adopts when they are considered ill, including taking time off work, seeking medical attention, and being excused for normal responsibilities. Illness behavior describes the individual's personal perception and response to physical symptoms, including how they interpret the symptoms and decide whether to seek medical care essentially. See here, sick role behavior is focusing on the social expectation or social behavior. Illness behavior focus on the individual's personal experience of symptoms. So this is the tip for you to identify. Sick role is social, SS sick social, illness is personal. Next question. The cardinal signs of the body include the following except option A, temperature, option B, blood pressure level, option C, blood glucose level, option D, heartbeat. Let us see the right answer. The right answer here is option C, blood glucose level. The cardinal signs of the human body include vital signs and the cardinal signs of inflammation. Vital signs, as you know, temperature, pulse, respiratory, and BP. Cardinal signs of inflammation: heart, body feels hot; pain, the body hurts; redness, the body appears red; and swelling, the body is swollen. So swelling, redness, pain, heat. So these all are the cardinal signs of inflammation, and the vital signs are temperature, pulse, respiration, BP. So here the blood glucose level is not there. So the word except, you have to be careful about the negative words like except. Again, I have to tell you. Next question. Which of the following symptom is common in clients with active tuberculosis? Option A, weight loss. Option B, increased appetite. Option C, dyspnea on exertion. And option D, mental status changes. Right answer here is option A, weight loss. See, the tuberculosis classic signs and symptoms are cough that lasts for weeks, chest pain, weight loss, fever, night sweats, etc. Next question. In the fetal skull, the brecma is found, option A, at the junction of sagittal, coronal, and frontal suture. Option B, at the junction of the lambdoid and sagittal suture. Option C, between the two halves of the frontal bone. And option D, between the frontal bone and parietal bone. Let us go to the right answer. Right answer is at the junction of sagittal, coronal and frontal suture. Let us see the diagrams. Brecma is the anterior fontanelle and lambda is the posterior fontanelle. And brecma is with the diamond shape, diameter 2 to 4, fuses 12 to 8 months. Lambda, posterior fontanelle, triangular shape, diameter 1 to 1.5, fuses at 1 to 3 months. So, these all points you have to remember for many multiple choice questions which are being frequently asked in your exams. Then, this is the main picture you have to remember for identifying the sutures and the position and anterior fontanelle and posterior fontanelle. So, this is the anterior fontanelle. This is the frontal suture. This is coronal suture. And this is the sagittal suture. See, sagittal is between two parietal bone. That topic you already I explained before. It will come again. I am not going to explain it now, that formula, but still frontal to frontal here, frontal suture. Coronal suture we can see here, frontal to parietal. Then between two parietal bones, the sagittal suture is also there. So here the junction of this coronal, sagittal and frontal suture is brecma or anterior fontanelle. The next question. The primary role of the pediatric nurse is to provide nursing care as option A, collaborator, care coordinator and advisor. Option B, an advocate, educator and manager. Option C, an independent and autonomous practitioner. Option D, clinical specialist and case manager. Let us see the right answer. This is an application level kind of question. The right answer is an advocate, educator and manager. Let us see the main characteristics of pediatric nurse roles. That is primary caregiver, coordinator, collaborator, advocate, health educator, manager, counselor, nurse consultant and social worker and researcher. Here this C and D, it is straight away we can eliminate because an independent and autonomous practitioner is clinical nurse practitioner is another kind of scope, and clinical specialist and case manager is also another specialist is another kind of. So these options we can remove from this. So the pediatric nurse will be either a collaborator, care coordinator and advisor, or an advocate, educator and manager. Let us see the peculiarities in this list. Collaborator is already here. Yes, it is right. Care coordinator is also here. But advisor role is not significantly mentioned in the list. Advisor is not there. Here, advocate. Yes, nurse advocate is the role for that. Not advisor, it is an advocate. And educator. Rather than advisor, it is educator, nurse educator to educate the parents. And the nurse manager. Here the manager role. So this option B is most appropriate options in this. So you have to select according to this criteria for this kind of questions. Next question. Which of the following infection is most frequently found in long-term care patients? Option A, skin and soft tissue. Option B, gastrointestinal tract. Option C, urinary tract. And option D, respiratory tract. Let us see the right answer. The right answer here is urinary tract infections. Urinary tract infections or UTI are most common infection in long-term care patients. Other common infections include respiratory tract infection RTI, skin infection, soft tissue infection, etc. But the most common infections are UTI or urinary tract infections. Next question. Mahatma Gandhi's first Satyagraha movement is option A, Khilafat movement, option B, non-violence, option C, Champaran Satyagraha, option D, Salt Satyagraha. This is a kind of general knowledge. I am just adding slowly the general knowledge and logic reasoning also. So just try to attempt this kind of questions, especially for RRP and some other government exams. Let us see the answer here. Option C, Champaran Satyagraha is the right answer. It is the first movement for Mahatma Gandhi. Let us see the movements in order. Champaran Satyagraha in year of 1970, that is the first one. Khilafat 1990, that is second. The non-cooperation movement is at 1920, that is also called non-violence movement, and the Satyagraha, Salt Satyagraha, was in 1930. Next question, the immunity that is transferred from the maternal antibodies to fetus transplacentally and to the infant through breast milk to protect them till their own immune system mature to function is a kind of option A, innate immunity, option B, acquired immunity, option C, active immunity, option D, passive immunity. So this kind of immunity is known as passive immunity. Innate immunity is the immunity present at birth. So the innate immunity is always present at birth itself. That is the inborn immunity. Then another kind of immunities are acquired immunity, that is acquired through our life after the birth. So acquiring process will happen naturally or artificially. These two type of acquiring process can happen, and it can happen actively or passively as well. Some voluntarily we are taking, and some by natural process it will happen. So the acquired natural immunity and acquired artificial immunities are available. So the active immunity, again, that also will happen in natural and artificial method. The natural active immunity will happen after you get an active infection and your body is already experiencing that. Then you will get the active natural immunity. The similar way, the artificial immunity will be getting by the vaccine. Your body will be exposed to that attenuated or particles of that antigen or the agent, and your body will get it. That is the artificial way, by vaccination you will get. Then passive immunity, that is the one which we see in this question. Through breast milk, naturally you will get, and through the immunoglobulin injections, you will get it artificially. Next question. The artery that supplies blood to diaphragm is called option A, inferior mesenteric artery, option B, supracranial artery, option C, inferior phrenic artery, and option D, coiliac artery. Let us see the right answer. The right answer is inferior phrenic artery. The inferior phrenic artery are the pair of arteries that supply blood to the diaphragm and other organs. Next question. Rice water stool is a symptom of option A, cholera, option B is typhoid, option C, dysentery, and option D, inflammatory bowel disease. Let us see the right answer. The right answer here is option A, cholera. Rice water stools are the symptoms of cholera, a bacterial infection that causes severe diarrhea. So the short term here is rice water cholera, currant jelly intussusception, and ribbon-like stools are in irritable bowel syndrome or IBS. Next question. Congenital absence or closure of a normal body orifice or tubular organ is called option A, fistula, option B, atresia, option C, hernia, and option D, stenosis. Let us see the right answer. The right answer here is option B, atresia. Atresia is a condition where a body passage or opening is closed or absent. Stenosis is narrowing of a passageway in the body that can affect blood vessels, heart valves, and other tubular organs. So atresia is closure or absence. Then stenosis is narrowing. Then hernia is a bulge or lump that occurs when an organ or tissue pushes through a weakness in the abdominal wall. So that is the bulge. Hernia is a bulge, and fistula is an abnormal connection between two parts of the body, such as organs, blood vessels, or intestines. So here the tips for you. Atresia, closure or absence of opening. Stenosis, narrowing. Fistula, connection. Abnormal connection is fistula, and hernia is the bulge or lump. Next question. The largest volume of air which can be expelled from the lungs during maximum expiration is called option A, tidal volume, option B, residual volume, option C, inspiratory reserve volume, option D, expiratory reserve volume. Let us see the right answer here. The right answer is expiratory reserve volume. Let us see what is tidal volume. The amount of air passes in and out of lungs during each cycle of normal respiration. When you breathe normally, the amount of air passes in and out of lungs is tidal volume. Residual volume, the volume of air in lungs after a forced expiration. After you forcefully expire the entire volume of your inspiration, then after that expiration, the volume remaining in your lungs is residual volume. Inspiratory reserve volume or IRV is the maximum amount of air that can be inhaled after a normal breath. So after a normal breath, the maximum amount of air that can be inhaled, the additional amount, that is inspiratory reserve volume. Expiratory reserve volume is the same way. ERV is the amount of air that can be forcefully exhaled after a normal breath. After a normal breath, some amount you can again exhale. Or after a normal breath, some air you can inhale as well. So that is the inhaled air is inspiratory reserve volume or IRV, and the expel or exhaled air is the expiratory reserve volume. Next question. The premature closure of sagittal suture is called option A, scaphocephaly, option B, oxycephaly, option C, acrocephaly, and option D, anencephaly. Let us see the right answer. The right answer here is option A, scaphocephaly. Scaphocephaly is the premature closure of the sagittal suture. Oxycephaly, premature closure of coronal suture. Acrocephaly, premature closure of the cranial suture. Anencephaly, improper closure of neural tube. So here the tip: scaphocephaly sagittal, oxycephaly coronal, acrocephaly cranial, anencephaly neural tube. So remember like this. The memory tip again: scaphocephaly, scap, boat, ox, con, acro, brachyfront. So we are mentioning the shape also here for your better understanding. Scaphocephaly is boat shaped, oxycephaly is conic or pointed, and brachycephaly is flat shaped. Next question. The process by which medium is placed at 100 degrees Celsius in flowing steam for 30 minutes each on 3 successive days is option A, steam under pressure, option B, autoclave, option C, tindalization, and option D, inspissation. The right answer is, we'll see the right answer here. The right answer is tindalization. Tindalization is a special process, fractional sterilization, and discontinuous heating. It's a form of sterilization that involves boiling the goods to be sterilized in the cans or jars at 100 degrees centigrade for about 15 to 20 minutes a day for 3 days in a row. So the goods will be sterilized in their own cans or jars at 100 degrees centigrade for 15 to 20 minutes every day for 3 days. That is tindalization, special process. Last question of this series. In this part, temporary loss of muscle tone and weakness precipitated by a variety of emotional states is called option A, cataplexy, option B, catharsis, option C, compulsion, option D, confabulation. Let us see the right answer. The right answer here is option A, cataplexy. Cataplexy is a sudden episode of muscle weakness that occurs while a person is conscious.